Hello, my name is Jatin Shah. I'm an associate professor in the myeloma section at MD Anderson Cancer Center in Houston, Texas. I'm here at ASH in San Francisco presenting the results of our Connect MM poster looking at the multiple myeloma disease registry and specifically the interim analysis of overall survival and outcomes in patients with high-risk disease. So the Connect MM registry is the first and largest prospective observational US-based multi-center registry looking at patients with newly diagnosed symptomatic myeloma, really to understand and characterize myeloma that's treated in the community and the treatment patterns and outcomes in these patients. In this study we enrolled approximately 1,500 patients with newly diagnosed myeloma who had their myeloma diagnosed within the past 2 months. The trial enrolled 1,493 patients, and we looked at patients' baseline demographics, including their age, their gender, and a number of other demographics. And then we also looked every 3 months in patients with the disease characteristics, including the treatment options, the treatments they received, their outcomes with those therapies. In this study, there are several interesting findings that we noted that we presented at ASH this year. The first was we identified approximately 253 patients with high-risk myeloma, or approximately 18% of the patient population, and specifically 108 patients with deletion 17p. And this is one of the largest data sets with both high-risk disease as well as deletion 17p in the newly diagnosed myeloma setting that we have to date. The median age of the patients enrolled in the trial was 67, and interestingly we found the median overall survival in this patient population is 44.4 months. We next tried to identify risk factors that could impact the outcomes in these patients and the overall survival. Based on univariate and multivariate analysis, the risk factors that accounted or impacted outcomes included ISS stage, things that we do know about, ECOG performance status. Interestingly, we also found a history of diabetes, anemia, renal dysfunction, as well as thrombocytopenia at baseline also resulted in differences in outcomes and overall survival for patients. We also identified that patients who had an autologous stem cell transplant versus those who did not had a longer overall survival, as well as those patients who had triplet-based therapy versus those who did not had a longer overall survival. Conversely, we also noted that age and gender did not play a role in outcomes. The other interesting finding was looking at patients with high-risk disease, and what we found is that patients with high-risk disease did not have a significantly lower overall survival than patients without high-risk disease. However, when we looked at patients with deletion 17p specifically, they continued to have a lower overall survival compared to the rest of the patient population, and triplet therapy did not make a difference in outcomes in these patients. The next steps in the study is a further enrollment of an additional 1,500 patients into the registry that's ongoing currently and will complete over the next 12 to 18 months. We'll further look at high-risk disease, identify various factors that may impact outcomes in patients with high-risk disease in this largest data set that's available currently.